Something strange is happening in West Virginia. After a flying start to the US state's COVID-19 inoculation program, vaccination rates have hit a wall. The National reported from here in February as troops helped administer shots to West Virginians. At first, the state led the country, but today, West Virginia ranks as the least vaccinated territory in America. A little over 40% of the population has been fully vaccinated against COVID-19. We traveled to Morgantown, a small city on the Monongahela River, to find out how West Virginia was faring during the country's Delta surge. This is Dr. Clay Marsh, the man leading the state's charge against the pandemic.
You know, we spoke 8 months ago and West Virginia was leading the country. What's happened?
Well, I think, Willie, we have seen the same impact of vaccine hesitancy and people where vaccines don't make sense here in West Virginia, like we have in some other parts of the country, particularly some of the rural states.
And that hesitancy caused an explosion of cases. More than 4,000 people have died from the virus in West Virginia, a hefty toll for a state of only 1.7 million.
When we look at the first week in July, Willie, we had less than 1,000 total cases. We had about 57 people in the hospitals. We had, less than 20 people in the ICUs and single digits of people on ventilators. We had 6 people who had died in the first 2 weeks in July. And this past week, we had 200 people that died. Our hospitals have been full. We had previously had a maximum of about 812 people in our hospitals from COVID-19. During this surge, it went up to 1,012. Our ventilator use and our ICU use were at all-time highs. And so it's been really, really challenging for all people.
On the streets of Morgantown, most of the people we spoke to were vaccinated. But some told us they weren't planning on taking the shot.
Some of the factors I'm a little hesitant about, and I don't know, it's like I gotta go out of my way to go get it.
We spoke to a young West Virginia student this morning who said basically he couldn't be bothered. What do you say to someone like that?
Willie, we know today that children are just as likely as adults in being able to catch and to spread COVID-19. Perhaps as many as 25 to even 50%, depending on how old and how sick you are, of people who get COVID-19 acutely may have long-term side effects of COVID-19, so-called long COVID syndrome. So I would be very worried for that student.
But beyond apathy is another form of vaccine resistance. The internet is rife with conspiracy theories about the COVID-19 vaccine. Some theories claim the shot contains a microchip meant to track people, or that it can genetically modify the human body. Some even deny the very existence of the pandemic.
How do you combat that?
I don't think you do combat it. I think what you try to do, and what we've tried to do, and the governor's tried to do, is to not fracture our state down the middle. He believes very strongly that central governmental mandates for vaccine is not the way to go, at least in West Virginia. Certainly, we have many private industries, for instance, our healthcare industry, hospitals, and long-term care facilities, which are among our largest employers in West Virginia, have decided to mandate vaccines for all their employees. And so over time, we see that can make a significant difference. But I do think that this is really a problem that is somewhat intractable across not just West Virginia, but much of our country. We don't see things as they are, we see them as we are. And so I think everybody sees the world through their own lens, their own narrative, what they believe.
And Clay's team is working hard to up the ante in West Virginia's vaccine drive. We spoke with Krista Capehart, who runs a community outreach program aimed at vaccinating difficult-to-reach residents in the rural state.
Once you have that initial push, where you have all the people that want to get the vaccine, you pretty quickly get to those people that you have to take the vaccine to. Because they're no longer willing to come to the vaccine. And we have a lot of that in West Virginia. One instance, I drove 3 hours one way to get to a coal mine just to vaccinate those workers and their families at that coal mine that day. Appalachia is very much an environment where as soon as you tell someone you have to do something, we immediately want to do the other thing. So recognizing that as we're working with our patients is the key to truly making those changes and having a good public health outcome.
In the end, West Virginia's strategy against COVID-19 is about saving as many lives as possible, while respecting residents' strong libertarian views. Clay left us with a story he often reflects on, one that may give some hope to West Virginians.
It's a story about a child who's walking down the beach and sees a whole large number of starfish that have washed up on the beach from the ocean, and recognizing that the starfish would die if they weren't in the water, starts to place the starfish back in the ocean one by one by one. An adult walks by and sees how many starfish are on the beach and starts laughing at the child and says, you know, you're wasting your time. You'll never get all those starfish back in the ocean. And the child looks at the adult and says, you may be right, but for the ones that we do, we'll make a big difference.